Hello, everyone. Welcome to our one-year anniversary of the Health and Wealth Network. As part of our celebration of the network, we're highlighting the amazing work of some local medical financial partnerships. I've got two great speakers for you today. We have Amanda Feinstein, who's the director of Oakland Promise Brilliant Baby Program. We also have Dr. Dayna Long, who's a pediatrician and the founder of the Family Information and Navigation Center at the UCSF Benioff Children's Hospital. So welcome to this conversation. We're really excited to get to hear from both of you. I'm just going to jump right in. So to start off, I was wondering if you could describe the collaboration between Brilliant Baby and UCSF and how you sort of address the connections between health and wealth in your work. And Amanda, I was hoping you could maybe kick us off.
Sure, happy to. And thank you for this opportunity. We're excited about the work we do, and we're excited to talk with you about it today. Brilliant Baby is part of the Oakland Promise, which is a large initiative launched by the City of Oakland in partnership with many of our public and nonprofit leading institutions here. In 2016, we launched. Our overarching mission is to improve the economic mobility and educational equity opportunities for our kids in Oakland. And we have programming that starts from infancy, which is Brilliant Baby, through elementary school, high school, and support for our students to go to college. We knew that as we started Brilliant Baby, which was really focused on supporting parents with low-income parents, Medi-Cal eligible parents specifically, with new babies, that we needed to support them to focus on their child's early health and development, and that a key way to do that was both with a college savings account. So we opened $500 college savings accounts for babies, but also support parents around their family's financial well-being. And so it's a financial coaching and support program complementing an early a college savings account for babies. We reached out very early in the design of this project to UCSF Benioff Children's Hospital, working with Dr. Dayna Long and her team to build a partnership with the medical home of these families that we hoped to reach out, engage, and serve. And so the genesis is really knowing that how do we connect with low-income families with a new baby? Mm-hmm. Pediatric care is a kind of common experience and would be a natural complementary service to what we had to offer.
Great, that was really helpful. So Dr. Long, what would you add?
I agree with everything that Amanda just said. I am a pediatrician. I also am the director of our Center for Child and Community Health at UCSF Benioff Children's Hospital, Oakland, and I have a long history of doing research and clinical care around addressing social determinants of health and early childhood adversity. We have long sort of created standardized work around community health workers and navigation in terms of screening and referrals for unmet basic needs, as well as working on a state level in order to advocate for how do you actually screen and address trauma in order to promote healing and wellness. And so when the city came to us and said, we're really interested in how do we think about wealth generation through education and creating an expectation for a college-bound future for all of our babies who are at or below the poverty level, it was really a natural fit. And it really helped to establish the role of UCSF Benioff Children's Hospital as an anchor institution where the community can come and say, we're interested in researching this topic or implementing this clinical program, and how can we actually make it standardized care? And so the fact that we now can enroll babies during well child checks and financial health is part of wellness has been really just a fantastic process for our providers. And it gives so much hope and inspiration to be able to say, not only is your baby healthy, but your baby's also going to go to college. And then thinking about how does an expectation for a college-bound future improve outcomes? And these are educational outcomes, economic outcomes, and health outcomes.
Great. That was so helpful. I think you guys did such a wonderful job of both talking about the partnerships and also sort of the potential. And I love, Dr. Long, how you touched on like the hopefulness that this creates to sort of for both for pediatricians and for families to set like a really different expectation early on. So I was wondering now if you could talk, COVID has been impacting every organization in so many different ways. And so if you could just share a little bit about how you've kind of continued to address these issues during the COVID-19 pandemic. And Dr. Long, I was wondering if you could start.
My clinic is a fairly qualified health center where 90% of our families are families of color and over 90% live at or below the poverty level. So one of our priorities was ensuring that we can maintain access to care during COVID and really quickly converting to virtual telehealth platforms as well as maintaining in-person visits so that kids aren't getting behind on their well checks and their vaccines. Because we'd already had this model where we are addressing determinants of health like food and housing, the need for activities, and now with COVID, more and more the need to get families connected to internet, to have devices for distance learning, getting reprieves from rent and filling out unemployment applications has really become our standard. And it really speaks to why medical homes are really important and why it is that community health workers are always part of our team. And so a lot of our pivot has been doing this virtual navigation work, reaching out to families through referrals that we receive in our electronic medical record, and then making sure that we're doing the screening and following up not only with the community organizations and families, but also with the providers. The way that we've been pivoting around the Brilliant Baby Project is really trying to reach out to families. We were doing our follow-ups with them in person, but shifting much more to virtual platforms, whether it's texting families, emailing families, or calling families, and then really thinking through how we're going to continue to connect them to the initiation of the 529 accounts, as well as the financial coaching in a virtual model.
Amanda, what would you add?
Well, after that handoff to our program and the enrollment, which as Dr. Long said, we're now doing over Zoom. The programming within Brilliant Baby that focuses on family financial well-being and supporting parents around essentially both stress in this time, which is much higher, and parenting practices. Our programming is also 100% virtual. So every family that enrolls with us has the opportunity to work one-on-one with a financial coach. And those are conversations that about 40% of the time were happening over the phone or video conference prior to COVID. And so it was not particularly challenging to pivot to 100%. And then we also initiated what has been incredibly popular, our community connections workshops. They're essentially Zoom support groups and financial topic workshops. And we are getting between 15 and 25 people. We offer them weekly in English, twice a month in Spanish, once a month in Cantonese, which is sort of reflecting the demand from our participants. But because of the isolation and stress of COVID, we're seeing families actually leaning into this component of the program even more than they did in the past. So participation is up, and the need to not only talk about financial topics, but just like self-care, support around parenting, how do you navigate the stimulus benefit opportunities, how do you navigate rent issues, some of these same issues that Dayna's talking about. We have our financial coaches able to engage with the participants and troubleshoot and move forward on their goals.
That's amazing that they're able to be so flexible and be such an incredible support during this time. And that's incredible that your participation is up, and it really shows how important of a service this must be for the community. So I was wondering next if you could just share a little bit about like how you measure the impact of services like financial coaching when it comes to health. Like what are the health outcomes that you see from those services? And maybe Amanda, you could get us started on this, then we can go to Dr. Long again.
Sure. So we are actually undertaking a randomized control trial in partnership with UCSF, Benioff Children's Hospital, and NORC at the University of Chicago to track over the next, at minimum into kindergarten, but our vision is all the way until these children are 25 and completing the whole series of Oakland Promise programs and off to college. But we're doing a randomized control trial with 200 participants. We have 3 branches to the study. One branch is the control, another is families who have the college savings accounts and our general community programming, and the others who have a college savings account for their baby and our financial coaching program. So we are in the early stages of that, but the research is looking at impacts on parents' stress, family financial well-being, parents' sense of efficacy and hopefulness for their children, and then health indicators and early development indicators for our children, both using electronic medical records data and also, as they get a little bit older, some actual interaction with the children around language development and kindergarten readiness. So we're in the early stages of that. Our children are by and large within this cohort, not yet 18 months old, so it's early times. Mm-hmm. But we've put together the study and the infrastructure to look really deeply and have very clear informative data that will help us document the impact of the intervention over time.
That's really exciting. It'll be really exciting when we can see the data. Dr. Long, what would you add?
So as an academic institution, it was imperative for us to incorporate gold standard research and evaluation from the beginning so that we actually can create a foundation of an evidence base for why partnerships that focus on financial health and wellness are so important and how it actually alters the trajectory of children and families. And so being able to, from the beginning, think about how do we actually structure a randomized controlled trial whereby every single arm of the study gets support and resources, whether it's basic needs resources to basic needs plus financial coaching to basic needs plus financial coaching plus the CSAs. And so that was thinking about how we structure that was really critical to our success. And so we have been enrolling in this randomized controlled trial now since the beginning. So for about a year and a little over a year. And we're really excited to continue to follow those kids. So I just want to clarify these arms of the study. So the control arm is sort of our standard of care, right? And our standard of care within UCSF Benioff Children's Hospital is that we do have a true focus on a medical home model whereby we have navigators that we pair with families to ensure that basic needs are met. The second arm is just the college savings account arm plus the basic needs arm. Mm-hmm. And then the third was those two components in the addition to financial coaching. And I think that we're going to have to see, I feel like research in this field is really early on, and I'm excited that we are contributing to the generation of evidence, and that the goal is that every single baby who's on Medicaid or who lives in poverty will have a college savings account that's established during their well child visits within the first year of life. I mean, that is the dream, right? And then to be able to have large cohorts of kids across the country who are going to college and thinking about what the economic benefits of that are for not only the family, but that entire community is just a really exciting proposition.
Yeah, no, it's really, really exciting. So my last question for both of you is, as you've kind of said, this is a new field. We're sort of in the early stages of testing these models. For people who want to learn more, whether they're on the financial capability side or the medical side, what would be things you would suggest they read, listen to, websites to look at, any kind of recommendations for folks who want to learn more about this? And maybe Amanda, you could get us started.
Sure. Well, the Asset Funders Network recently completed a report on the connection between health and wealth and models for doing that, particularly in the early years of children's lives. So I would check out the resources of the Asset Funders Network on that topic. We're happy to talk with others and share what we've developed and what we're learning. It's definitely a learning curve. We're continuing to expand our partnerships, starting to talk to an additional clinic in Oakland. We've been working for a long time with Alameda County Public Health infant home visiting programs, which it's not quite the same as a pediatric home, but also similar support to low-income families with a very new baby. There's a lot of trial and error. I would say build the collaboration, based on a shared vision of what we want for our kids and our families. It has to be a collaborative process, because we are all bringing incredible support systems and resources for the families that we want to serve. And the integration is really it can be complicated. Like, we spend a fair amount of time figuring out how to make this work, but it's I think, a pretty profound opportunity for families. And we'd love to see, as Dayna said, every baby born in our community, hopefully in other communities. We're involved in policy issues on the state level related to this to try and encourage expansion. But every child should have a college savings account in their name with a substantial amount of money in it, and support for their families around financial stress, which is such a force undermining parents' health and children's health.
Yeah. No, that's really great points. Dr. Long, anything you would add for stuff people should check out that are looking to learn more about this issue, want to get involved, things like that?
Yeah, and so the Oakland Promise has a great website, and so I would definitely refer you there. And there's some really special videos that are on that website that talk about not only Brilliant Baby, but the entire Oakland Promise initiative. And then, of course, I'm going to say you should read our papers once they come out, and we're really excited to share the data.
Great. Well, those are excellent suggestions, and we're excited to see the papers as soon as they're published. I just want to thank you both again for doing this. I think it's incredibly important conversation for the field, and it feels like a perfect way to celebrate the launch of the 1-year anniversary of our network, where we're really trying to highlight how important partnerships like this are and the potential for impact in the community. So I'm going to turn it over to my colleague Laura, who has a little plug for folks who wanted to connect to our community. We encourage everyone to get involved and sign up to hear more conversations like this.
As always, sign up to join the Prosperity Now Communities Health and Wealth Network and learn more about it. Follow the link below.